Hello everyone and welcome to the week 4 study group assignment. This week we've been covering content in the health promotion and maintenance client need area. And one of the areas that students have a lot of anxiety about for the exam is in the maternal newborn content. So in the module that we covered, you started to get into your content within intra, kind of anti and postpartum care. And so we're going to focus on some of that content today within your group. So one of the first things that we're going to do is look at any study maps that you may have made in this area. But we're going to focus on the questions that I have posted on this site, as well as, we're going to concept map preeclampsia as a group. So the first thing that I want you to do is in the health promotion and maintenance section, there was a nice case study on preeclampsia, and it was called Meghan Hann. If you haven't done this case study yet, how about you go into that module and work through it together as a group. If you have done it, then please access the module and look at the answers that you have together. After that, I want you to work through the questions that I have on the site, just around some of the pharmacology with meds in this topic area. And then the last thing that we're going to do is we're going to actually concept map one of the diseases. You can choose preeclampsia if you're still having trouble understanding it after doing that exercise, or you could choose another form of complication in labor, such as HELLP syndrome, or during pregnancy, like gestational hypertension or gestational diabetes. So for concept mapping, this is what I want you to do as a group. The first thing you're going to do is go up to either a whiteboard if you have access, or write on a large piece of paper. Choose your condition that you're going to cover. So the first thing you're going to do as a group is you're going to write from memory all the information that you remember about the pathophysiology of the condition. After you've done that, then you're going to write down what you would find on assessment of a client who is experiencing that condition. Then you'll move to writing down any diagnostic tests or labs that are used to monitor for that condition. And then the last part is you're going to look at what are the interventional strategies for that condition. So list any relevant medications. I suggest that you do this by class and try to identify one medication in each class. And then any special type of nursing interventions that we need to do, in regards to further assessment or treatment. Once you have done this, I want you to take some time and go through your maternal newborn textbook, as well as your pharmacology textbook. And in a different colored pen, either on your whiteboard or on your sheet of paper, I want you to list anything that you've missed. So read through your book as a group, list what you've missed, and then write it onto the whiteboard or that piece of paper. Okay? Then once you have gone through that, I want you to talk about it as a group and see what kind of content you need to pay a little bit more attention to. And then it's helpful to look at that entire patient case and talk through it as a group, as if you were a group of nurses working together with that patient from admission all the way to discharge. And so then that way we're working through the concepts as well. As you start going through the medications, think about the side effects and maybe some of the drug-to-drug interactions too. So this discussion is going to really help you consolidate the information that you need in this content area.